health needs of our local population have changed over the years, and we recognise particularly there are certain groups, so groups such as the frail elderly and children and young people, and groups with special needs such as mental health or substance misuse are overrepresented in our local population, and we're not sure that we're able to best meet the needs that they have with the current design of our hospital services. We recognise that some of our services are quite small, and that often means that we're unable to provide the quality of care for some patients that a bigger hospital would be able to provide. And so it's important for us to look at how we change services to better meet the needs of all of our population, not just a small proportion of it. The frail elderly would be better served by new services at the front door of our hospital, so in the emergency department, but are tailored and integrated with community and GP services to make sure that care for our frail elderly population is seamless as they move between those areas. We recognise that many local residents have children and have needs for their children that are better serviced locally than they would be by having to travel to Bristol or to Taunton. And by supporting the services that we already provide and extending the hours that our Seashore Centre, which already provides good care for children in daylight hours, extending that longer and at weekends would mean that we could provide a service that is much more seamless for our local population. I think traditionally hospitals have been places where you have come to have care separate from community and your GP. And by integrating services so that the people who are dealing with you know about the whole of your life and your illness rather than just little segments of it, has enormous benefits to you as a patient. We're all likely to use the health service, and we would all want to think that we don't have to continually repeat our stories, have to have mistakes that are made because our care has been handed from one department to another. By having much more integration, it means that communication can be much more streamlined, and the care that we have will be much more coherent. The biggest change for the hospital at Weston will be the emphasis on providing better services for our frail elderly population. We know there's an acute trust. We have the oldest average age of admission for our population in the whole of the UK, and that means that by focusing on services that provide local care for people so that they can avoid hospital if possible, to only come if they really need to, and have more services that are right for them at home, I think is a really important benefit of Healthy Weston.